Hi, I'm Dr. Richard Visone, and this is an introduction to integrated bodywork. I have conducted integrated bodywork seminars across the United States since 1995. And I created the seminar for two primary reasons. First reason was I was getting annoyed by people telling me that I had some kind of special powers or that I was psychic. And I know in my heart that I don't possess any special powers that everyone else possesses. Everyone has these powers. And why is it easy for me? It's because I do it all the time, right? Because that's the way the brain works. Through memory, it establishes patterns and cycles. And it constantly refers to what happened a minute ago to apply it to today. So the more often you do something, the easier it gets to do. That's all there is to it. It's very simple. And actually, quantum physics principles are actually very simple. So I had a lot of people through the years would tell me, especially after my lectures, that they were really interested in learning more about quantum physics. So they would ask me what books I would recommend. And I would tell them, I recommend not reading books on it, because what I found through many books that I had researched is that the books are written from people that are coming from either a primarily left brain perspective or a right brain perspective. Those that are coming from the left brain perspective, when they try to explain quantum physics, they get very technical and it's easy to get lost and not make any sense out of what they're saying because it seems totally intangible. And the people that come from the right brain perspective, a lot of the concepts seem totally nebulous and they're very difficult to concretize and apply and understand. So, as an answer to that, I wrote this book. It's called Hot Dogs and Healing. And I know you want to know why the title is Hot Dogs and Healing. At the time that I published this, I was finding that in my lectures, I was consistently spending a lot of time explaining the actions and the do's and don'ts of using certain supplements and dietary things. And I tell you, in reality, and I'm talking about reality, in reality, hot dogs are not bad for you if you understand that they are a form of chemical stress that your body has to adapt to and assimilate. And just like any stress, in small amounts, it can stimulate progress in the brain. But in excess, it's bad. So people don't understand that. And the same principle applies because holistic principles apply across the board. Same principle applies to supplementation. You can't randomly take supplements in random concentrations. There are very, very, very rarely have I recommended supplements to anyone, but if I did, it was for a specific reason, in a small dosage, and for a very limited amount of time, just to stimulate the nervous system to make changes. Anyway, that's the way it needs to be applied. I go through the supplements and everything, and you can text me or email me anytime if you have questions about specific supplements or how they should be used. So the idea, these principles that we learn, The idea is that, you know how they say in moderation everything's okay. In small amounts, anything is okay. And that's proven by the whole science of naturopathy, where they significantly dilute a substance and just introduce the idea of that substance into the body. That alone is enough to inspire the brain to respond and the body to make changes. Problem is, you can't depend on those things, and a lot of those treatments can be expensive because they're usually long-term treatments. Anyway, when I was researching, putting my seminar together, I was in this ancient mythical place called the library, and I was researching. I found 2 reference books that had, at the time, recently been published. One was called The Encyclopedia of Alternative Methods. The other one was called Alternative Medicine, The Definitive Guide. I hear bells going off. What they did in these publications, because they were reference books, is they categorized all different types of what they call alternative methods. And in one of the publications, they even gave a medical opinion about that particular method, which was interesting. Now, one thing that I noticed is that there was no mention in there at all about the benefits of massage. There was no mention about research that was released prior to the release of these reference books. There was no reference to research that showed that over 90% of diabetic children had a complete remission in diabetes, simply with massage only. What they did mention in the books is, so one's description of massage said that massage is a good thing to promote relaxation. But it said most doctors do not think to routinely recommend it to their patients, which is true. And it's a shame because of the power of massage, the power of body work. So we know that there are over 150 different methods of massage. But in just one general topic, they say massage is a way of releasing tension and making you feel relaxed. And that's the best that they could do. That's the best that they could do. It was ridiculous. And then they talked about other things, like they mentioned Reiki, which is a pure form of energy work. And they mentioned Reiki, and they say that for Reiki, they said that energy, if there is a system of energy pathways in the body, they have thus far eluded medical definition. It's not only that, they've eluded medical acceptance that they even exist. And that's a shame. So, what else did they say? Oh, what I found really interesting, because this was, as I said, around 1995, what I found real interesting in these publications is that when they talked about acupressure and acupuncture, their descriptions were, the medical opinions said that if you know that the meridian system has not been validated by the scientific community that it exists. But what they did say in the medical opinion is that acupuncture, specifically acupuncture, They didn't mention acupressure in this opinion. They said acupuncture can help to alleviate an array of problems. And why I found that so interesting was because just recently at the time, the AMA had approved medical doctors to take weekend courses in acupuncture, and they could bill the insurance companies for it. So suddenly, something became acceptable as a form of treatment for certain conditions. It's just ridiculous that there are people out there that have no concept of reality. I'm talking about reality. I'm not talking about the three-dimensional reality that our conscious mind creates. I'm talking about the fourth-dimensional reality that we exist in, that we live in as creators. So, when I graduated, when you go into chiropractic school, and this is another thing that can drive me crazy. Let's talk about chiropractic. They say chiropractic is good for low back pain, headaches. And that's basically all they say it's good for. They have no concept of what chiropractic is. And what most people don't know is that over 87% of a medical doctor's education is focused on pharmacology and toxicology, because they're messing with chemicals and they're handing out prescriptions. They need to understand how these chemicals affect the physiology. So about 87% of medical doctors' education is just pharmacology and toxicology. And what most people don't realize is that over 90% of our chiropractic education is focused on neurology, physiology. So whether they will ever accept the idea or not, even the world's most renowned neurologist really has a very limited perspective, a limited understanding of how the brain actually works. Because according to the medical approach, the more focused you become, like every medical doctor has to be a specialist now. You know, if your pinky hurts, you go to a pinky specialist. They got a specialist for everything. The problem is, as a specialist, you're limiting your scope of understanding of the body as a holistic perspective, the body as a whole. So, understanding, like for example, there was research that had been released. I never use any therapy in my practice. So as I was saying before, when you go to chiropractic school, you spend 12 quarters studying physiology and neurology, and what they tell us and teach us is the basis of chiropractic approach is energy. It's all based on neurological function and the release of and movement of energy through the system, because the brain controls everything. So they tell us that, and then when you get into the final stretch, when you're getting ready to graduate, that's when you take your practice management courses. And that's when they tell you, you have to wear a white jacket, you have to act like a doctor, take x-rays on every patient. What most people don't know is why we were told to take x-rays on every patient is not because every patient needs x-rays. It's because if you have something tangible in your hand to show them that's messed up, then you can validate your treatment plan. So they tell us that, and they also told us, obviously, don't talk about energy because they'll think you're a nut job. You have to just focus on their symptoms. And the other thing is most chiropractors make most of their money on supplements and on therapy, electric stimulation, heat, and things like that. So when I graduated, before I graduated, I was exposed to the system that I use, which is called network spinal analysis. And it changed my life. And I had some pretty neat experiences. I believe I referenced them in the book. But when I graduated, I said, this stuff really works. All based on pure energy work and understanding neurology and physical patterns. Well, what we call stress patterns, which I explained in the seminar. The idea is that when I graduated, I know my old man, who was real hardcore, very conservative, old-fashioned, he said to me, okay, well, you're going to get an x-ray machine, right? I said, well, I really don't need an x-ray machine. He said, you have to have an x-ray machine. So I sweat and put up lead-lined particle board and stuff on the walls, and I made an x-ray room, and I bought an x-ray machine. Never used it once. But it's just the way it is. The only time I have ever taken or referred anyone for x-rays was if I suspected a fracture, a bone fracture, or some sort of tissue damage that I needed to see. Not for the way I was going to treat the person, because that wouldn't affect that really, not much, but just so that I can avoid irritating the problem and making it worse. So the course is designed. I have the information on the integrated bodywork, which I will provide for everyone. It's a book that I set up. It's broken into 3 sections. The seminar itself was designed to be a 24-hour seminar, 3 days, 8 hours in a row. And it's broken into 3 sections. The first section explains the holistic principle, what it really means, and what the position is of the facilitator, the person doing the work, which is the utmost importance to understand what your position is in the interaction, in what you're doing. So I spent a lot of time explaining what a facilitator is and what your position is as a facilitator. The next section I get into is physiological facts and factors. And what I did was, I mentioned that there were 2 reasons I did this seminar. The first reason, because I know I can teach people how to enhance and develop their empathic abilities, their abilities to be able to feel what's going on with people and how to help that person relieve them of these patterns that they get stuck in. So the other reason that I created the seminar was because I was getting really upset. At the time, I was practicing in Las Vegas, and there's this culture of seminars. These people that do nothing but take seminars, get certifications. They want to be certified in everything. And so, specifically, I will mention the Upledger craniosacral seminars. I was really kind of getting upset about people taking them, and then they would come to me to help them understand what they supposedly learned in the seminar. And the way the seminars were set up at the time is that there were a set of 7 seminars. If you took all 7 seminars, you could get certified as an instructor or certified as a craniosacral therapist. But in every seminar, they would teach a little something, and then they would tell you what you're going to learn in the next seminar. And so it was just a string of money making and very little information. And the information that they got, believe it or not, quite a bit was wrong, flat out wrong. bad information. So I got upset with that, and I said, well, what I'm going to do is I'm going to take all the relevant information and put it together in such a way that all that information can be downloaded into your brain. So the seminar is set up in a holographic manner. The information is touched on and referenced back and forth and introduced in such a way that it's absorbed into the subconscious easier, so that even if you don't consciously know what to do, because truthfully, most people that have taken the seminar, at the end of the seminar, they feel confused. But then in the days and weeks after that, whenever they're working with someone, these things these information from the seminar would surface, and it would help to direct them and help them understand what was going on. So the first section is the holistic principles, to understand what holistic really means. Because, again, when I started my first practice, it used to make me crazy. I pulled my hair out. It made me crazy. People would come into my office. When I first opened my office, they'd be like, so you're a holistic doctor? I say, yeah. Oh, I tried that holistic crap. It just doesn't work. And I'd say, well, what did you do that was holistic that doesn't work? Because the fact of the matter is, holistic always works. It works every time. I've never seen it fail, if you understand the principles and the guidelines and follow them. They would say, well, I went to a naturopath. I go to a therapist here and that therapist there. And I say, well, what did you do that was holistic? Because therapy is not holistic. Whether it's physical therapy or mental therapy, it's not holistic. And the reasons for that, again, are pretty much described in my book. The book is designed to help you understand what's going on without having to think about it. That's a good way to put it. So first we have holistic principles, and then I go into physiological facts and factors, where I take all the pertinent information from many different systems of healthcare and I take all that information and get it together and present it so that you don't miss anything. And then the last part of the seminar is our charts and tools for integration. And basically what I always called the third or the final part of the seminar was hands-on workshop. What I'd like to do is get this information out there, and then when I have a few people interested in the information, then I want to come and do a hands-on workshop to actually show how to apply the information, how to apply techniques, how to integrate things. I think it was the third time, this is the third seminar that I was teaching, and it was in Las Vegas. And a psychotherapist who was a patient of mine came to me and she said, Doctor, I would really love to take your seminar, but I don't really think it would help me because I'm just a psychotherapist. I'll tell you what used to make me totally crazy when someone would come and say, but I could never do what you do. I'm just a massage therapist. And I want to smack them one, because you don't understand the power in your hands. You just have to know how to use it. You got the tools. You just know how to use them. All right. So she said, I don't know that it could help me, but I would really like to learn. And I said, well, it could help you immensely. But you know that I require all people taking seminar to have a certain anatomical knowledge, physiological knowledge, to make it easier for me to present the information and help them integrate some of that. So at first, I was requiring anyone that wanted to take the seminar to have a background in nursing or physical therapy or some kind of physical healthcare background. And she said, well, Doc, it's just like this. If I could read people the way you read them, then I feel like I won't have to sit around listening to their bullshit all day long. Those are her words to me. I said, you know what? That's a good point. If you did understand these stress patterns and you could develop your empathic abilities, be able to feel what's behind what a person is saying, or understand what's underneath the tension or the stress they're expressing on the surface, then you would be able to help them immensely. I said, sure. So I let her take the seminar, and it turned out to be one of the most productive and eye-opening experiences, not just for me and for her, but for everybody that was in attendance. So it's all about understanding. You know, Plato wrote a story about a cave, and he talked about three guys that were born and lived their entire lives in the cave, and they just stared at the walls in the cave. One of them, for some reason, turned his head, and when he did, he saw the entrance to the cave, and he realized that there was something else going on out there, a whole other world that they had never even experienced or known existed. And the funny thing is, when he tried to explain it to his friends, they just stared at the wall and said, "You're a lunatic. You're imagining it." That's like the way it works. There is a whole other world out there. And understanding that world and accepting it can catapult you in personal relationships, in personal health issues, in the way that you experience life. There is a whole other world that we don't see. We can see, but we don't. We look past it because we're too preoccupied all the time. So the Integrated Bodywork Seminar is about giving you a new perspective and being able to understand things that may have seemed confusing before. Why is it when I sit next to this person, I feel irritable? Why do I feel like I want to cry when that person walked in the room? There's a reason for it all. It's not just some whatever, it doesn't matter. It matters if you care. It does matter. Because if you can understand what's going on, if you can see reality from what I call fake reality, which is the three-dimensional conscious reality we create according to our past experiences and what we expect, it's a whole different world. And so what I like to do is open up minds to this other world. I want people to see and feel and experience that there is so much beyond the physical three-dimensional reality that we perceive. I want to bring people into that fourth dimension so that they can become more objective and in that way have a broader, more holistic perspective of what's going on in their life and the universe, which gives them the opportunity to make better choices. So that's the Integrated Bodywork Seminars. I really am here for educational purposes. I practiced for 30 years. I've had so many experiences. I've learned so much. And I realize that I need to pass this information on because other people need to take the baton and further the exploration of this world that we exist in, the exploration of the world of quantum reality, of energy, to understand how our life experiences affect our physiology. No, when I was practicing in Vegas, I was asked to do a lecture for the Dental Association of Nevada. And the person that asked me said, "I'm looking for speakers, but we've never had a chiropractor speak. because we're dentists. Do you think you'd have anything to talk about? I said, sure, I'll find something to talk about. And it turned into a 2-hour lecture. And I told them, for 2 hours, I tried to explain to them the biomechanics behind TMJ and why a dentist should never mess with anybody with TMJ. Because in my experience, greater than 80% of temporomandibular joint imbalances and issues are actually arising because of a pelvic imbalance. And if a person is balanced by a body worker or an energy worker or somebody who knows what they're doing, the TMJ can resolve on its own very easily. Very often the problem is not in the temporomandibular joint. But the problem is you go to the dentist and he's trained in this, he'll definitely address the temporomandibular joint. Now, if you address the point of symptomatology, all you do is push it back into the area of origin, and you create more tension at the origin of that stress. So biomechanically, you really need to understand how the body works, how important breathing is, motion, what motions are good, understanding therapeutic applications on a much, much, much deeper level. Because I have never used physical therapy. I say that, although there are times when, and it's important, but there are times when I will be therapeutic in my approach. The important thing is to understand when you can be therapeutic and not just facilitating. You need to know when you can apply therapy. And when I do, I apply it in the form of acupressure or reflexology or something like that. But never, 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 ever, 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 ever use electricity. Your nervous system controls everything. Your nervous system, your brain isn't even solid. It's what they call a piezoelectric gel. It's there to conduct electrical impulses. So you start shooting electricity into your body. Yeah, the electrical overload will release calcium ions and force the muscles to relax. But the electrical input into the nervous system just irritates the brain and reinforces the pattern that created the symptoms in the first place. So just for example, these are the way you have to understand when we're approaching people and we're working on people. The brain responds by suggestion. It doesn't need a sledgehammer. It's a very important concept. It doesn't take a lot of force. It doesn't take a lot of time. It's a matter of pushing the right buttons in the right order, and the system unwinds and restores normal function. As I said, I'm not going to go crazy explaining to you all the crazy experiences that I've had doing the work. But even from the stories that I heard when I personally experienced them, it blew my mind. Just with a simple, light touch. Just by being there and understanding your position as a facilitator and understanding what the whole interaction is that's going on between you and the person you're working on, I should say working with. Understanding your role as a facilitator, and then having, on top of that, an understanding of biomechanics. It's just mind-blowing, the things you can do, the way you can help people. So there's so much involved in this. There's so much information. So I hope you're interested in learning about integrated bodywork and getting all this information downloaded into your brain. The only thing it can do is help you understand your life and your relationships better and brighten up everyone else's life that you touch. Thank you.